Now, how many people remember the commercial? This is your brain on drugs. Honestly, we could use this advertisement for our medical prescriptions as well. Did you know that a group of scientists used a computer program to analyze 5,600 drug labels and more than 500 listed side effects? Now, the results of this was astounding. They found that the average drug comes with a list of at least 70 potential reactions, according to researchers. Now, one of the premier natural health websites entitled Morcola.com stated the more commonly prescribed drugs averaged around 100 side effects, and some of those had at least 525 different listed reactions. Can you imagine that? This poses a problem with our prescription medications that the Food and Drug Administration doesn't want to address. Now, my topic of discussion that I'll be informing you about today is natural alternatives should be insurable prescriptions for longevity and a healthier America. In my topic, I'll briefly discuss 3 points. Number one, some prescription drugs cause dependency, resulting in suicide. Number two, case studies show that complementary and alternative medications, or what we call CAM, okay, has tremendously improved healing results. And number three, more people today are using CAM in conjunction with conventional medications because it's healthier and renders greater results. Okay. Has anyone heard about the opioid crisis in our country? Now, opioids are substances that produce morphine effects and are primarily used for pain relief, including anesthesia. According to the National Vital Statistics System, incidence of fatal prescription opioid overdose and abuse is prevalent in the age ranges of 12 years and older. Now, over 130 people in the US die every day from opioids overdose. Now, prescription opioids account for approximately 70% of fatal prescription drug overdoses. Financially, the financial burden is estimated to 78.5 billion. Now, over one third of this cost was due to increased healthcare, substance abuse treatment, and criminal justice costs. Now, some might ask, how did this happen? According to the National Vital Statistics System, in the 1990s, pharmaceutical companies were guaranteeing medical communities that patients would not become addicted to opioid pain relievers, and healthcare providers began to prescribe that at greater rates. Now, this subsequently led to many people being misinformed, and it became clear that these medications could indeed be highly addictive. Now, in 2017, over 2 million people suffered from substance abuse disorder. Now that we've identified a serious problem with our prescribed medications, let's talk about our second point, which deals with alternatives. CAM has been very successful in many countries. According to the research conducted by Professor Margarita Poto and Sai Wong, they conducted or concluded that integrative methods of CAM and conventional medicine helps to solve the health challenges in our fragmented healthcare system. Now, many people are open to herbal remedies and therapies because they've been tried and tested and successfully in different countries. A case study was conducted for cancer by herbalist Carrie Bone, co-founder of research and development for MetaHerb Pty Ltd. Now, the findings for this showed significant improvements in 5-year survival rates of breast, lung, colorectal, and gastric cancers in controlled clinical trials. And finally, if significant improvements are being made, what are the percentages of people that are using CAM? According to the National Center for Complementary Integrative Health, 38% of adults and children, or 12% of children, use some form of CAM. In conclusion, we have covered natural alternatives for prescription medication and how they increase longevity for a healthier America. Its popularity and proven scientific benefits are documented and should be incorporated into our Medicare and various insurance programs, especially when some controlled substances are causing dependency and suicide. Thank you for tuning in, and until next time, peace.